Interestingly enough, contractors have the power to do something about opioid use and opioid treatment in the workplace. The first thing they have to do is rely on their third-party administrator who takes care of their claims to have programs in place to deal with it, to have edits that come from the pharmacy that tell us when expensive or opioid drugs are being used, to have clinicians to deal with these issues and talk one-on-one with the treating physicians. Second thing that they can do is use high-quality physicians. In a lot of states, you have the choice of physicians. And for example, we understand at Sedgwick, we understand high-performing physicians. We score physicians across the country, and we understand when you have a high-quality physician, and we know that their prescribing patterns are much lower for opioids. Their communication skills are terrific, and they prescribe fewer of these types of options for injured workers. And then lastly, what construction companies can do is ensure that they're using doctors who use the best practices for opioids for prescribing. So, for example, do a urine drug test to make sure they're actually taking the medication. You'd be surprised the number of workers who have these prescriptions every month and yet they're not taking them. Do a risk assessment, which is a short questionnaire on whether or not the injured worker would be at risk for addiction or overdose. Make sure you're checking the prescription drug monitoring websites for each state so that you know what other drugs are being prescribed for the injured worker. And then the most important thing of all is these physicians need to tell the worker, this is a trial. This is not a long-time drug that I'm going to be prescribing you, so we're going to try it for a week, maybe two, and then we're going to get you back to function and back to a better life.